Hello everyone, myself Shweta Thapar, Chief Embryologist of Dikshit Hospital and Harshay IVF Center. Today we will having an overview of IVF or ICSI. So let's start. What is infertility? 1 year of well-timed, unprotected intercourse without a pregnancy. 10 to 15% of population is infertile. 1 to 20% of couples have unexplained infertility. Causes of infertility. Normal basic causes of infertility, female infertility, male infertility, mixed infertility causes and unexplained infertility causes. In this slide you can see causes of female infertility and causes of male infertility. There are so many things. In a male infertility there are varicocele, unexplained, sexual factors, immune system factors, there are lot of. And causes of female fertility, tubal factors, hormonal imbalance, endometriosis, tubal blockage, etc. Now we having a problem of infertility. So we have so many solutions too. Now let's start with ART, assisted reproductive techniques. We have first one is IUI, intrauterine insemination. Second one is IVF plus ET, in vitro fertilization plus embryo transfer. Third is ICSI, intracytoplasmic sperm injection. So we'll start with first one, IUI. What is IUI? Injection of washed prepared sperms into the uterine cavity through a fine catheter during pre-ovulatory phase in a natural or stimulated cycle. Although pregnancy may not occur as quickly, a policy of initial treatment by IUI will probably save 20% of couples from moving to IVF. After 3 to 6 cycles of failed IUI treatment, patients should be encouraged to optimize for an IVF. Indication for intrauterine insemination IUI. What are the indications? At least one fallopian tube must be there for patent for normal IUI cycles. Mild male infertility, unexplained infertility, ovulatory dysfunction, PCOS, mild endometriosis, cervical factors, etc. Now in IUI what we are doing? Sperm preparation. So in IUI we are doing stimulated or non-stimulated IUI. But when we are planning for IUI, intrauterine insemination, on that day we need to prepare sperm for washing. We have two techniques. One is swim up, second one is density gradient. In this slide you can see both the techniques are there. Now intrauterine insemination goals. What are the goals? Goals is to maximize the chance of fertilization, increase number of eggs, position sperm closer to eggs. Now next, IVF, in vitro fertilization. What are the indications for IVF? Tubal factor, ovulation disorders, endometriosis, uterine fibroids, previous tubal sterilization or removal, unexplained infertility, a genetic disorder, fertility preservation for cancer or other health conditions. Now, IVF and ET. In vitro fertilization and embryo transfer are the basic ART. Intracytoplasmic sperm injection, ICSI, assisted hatching, pre-implantation genetic diagnosis, PGD, cryopreservations, donor oocyte IVF programs, intracytoplasmic morphologically selected sperm injection and many more. We have various steps of an IVF treatment cycle. First one is ovarian stimulation. Second, follicle puncture like OPU, ovum pickup. Third one is sperm preparation. Then we are fertilizing egg with sperm. Fifth one, embryo culture, and there we are transferring good embryos. Now first, egg retrieval. During the procedure, an ultrasound probe is inserted into your vagina to identify the follicles, and the needle is guided through the vagina and into the follicles. Now we'll do sperm preparation by swim up method or density gradient centrifugation. Now we will talk about conventional IVF. What is conventional IVF? Simply put, IVF is adding a man's sperm to his female partner egg in the laboratory to produce embryos. In vitro fertilization is an option for many couples who cannot conceive through conventional therapies. These embryos are put back into the uterus after 3 to 5 days of being in the incubator. Now we have in vitro embryo development. Now first we are getting M2 eggs in ICSI, but if we are going for in vitro fertilization, we are not denuding the egg. We are just putting sperms together with eggs and they will fertilize naturally. This is IVF. Now other fertilization treatment is there for infertile couple, male factors. If male factor is there, low sperm count, poor morphology, so we need to go for ICSI, intracytoplasmic sperm injection. Unprecedented successful development of ART, which has revolutionized the management of severe male infertility. The procedure involves the direct injection of a single sperm into the egg cytoplasm. This is ICSI. Indication for ICSI: sperm completely absent for the ejaculation, like azoospermia. Sperm present in low concentration, it is oligospermia. Poor sperm motility, asthenospermia. Poor sperm morphology, teratospermia. Sperm retrieved by surgical techniques like TISA and TESE. History of fertilization failure in conventional IVF. If we have history of conventional IVF failure, fertilization failure, so we should go for ICSI, intracytoplasmic sperm injection for fertilization. Now we have same in vitro embryo development in this day 1, day 2, day 3, day 4 and day 5. You can see in this slide. Now the last step is embryo transfer. After fertilization procedure, whether it is IVF, whether it is ICSI, we are getting fertilized embryos. Day 2, day 3 or day 5, we can transfer it back into the patient's uterus. How many embryos are transferred? Related to age and embryo quality, if patient's age is less than 35, you can put 2 embryos is more than enough. If patient's age is more than 35 or 37, 2 to 3. For patients with 2 or more failed IVF cycles or a poor prognosis, can add more based on clinical judgments. So today we had discussed about our ART treatments like IUI, IVF, ICSI. If you want to know about in detail, you can contact me. If you have any query or question related to this, you can connect me. I will be happy to answer you. Thank you.